SNAP can be such a difficult program to talk about, and we won't go too far into it in this conversation, but some people can have a really negative attitude toward people who are utilizing that benefit. But really, as a food bank, we would prefer that more people are accessing that benefit, especially to your point in the rural communities,
Yeah,
because we know it drives revenue for grocers. It helps keep those food access points open in those communities, but it also
absolutely.
gives choice for people at the grocery store instead of like our mobile distribution where it's a pre-packed box. And so I will now add that when it's no longer preliminary and you say I can to the reasons why SNAP is a good program, really for people who qualify for it. Welcome to May and our first episode of the month on 50 Faces of Feeding South Dakota. We've had some really great conversation about our volunteers across the state this past month and all of the great work that they're doing to make our mission to end hunger in South Dakota possible. We're going to shift a little bit this month and talk about rural hunger and the challenges that we face in South Dakota having a predominantly rural state. Joining us for our first conversation today is Dr. Hockett with Avera Research Institute. Dr. Hockett, thanks for being here. Why don't you start by introducing yourself? Tell us a little about you.
Thank you, Stacy. Yeah, so I'm Chrissy Hockett. I am originally from Brookings, South Dakota, and grew up and graduated high school and went to SDSU, and then moved out of the state for several years. And my husband and family came back in 2019, and we currently live in Rapid City. So we call South Dakota home, and we're excited to be back.
I shook my head, not in a negative way, but I really am like keeping a tally of jacks versus,
Yeah,
USD coyotes.
yeah,
And jacks are just like taking the lead here. So
go Jack.
that go jacks. So that was the reason I shook my head. I do want to tell our audience, though, I'm not only recruiting podcast guests from SDSU. So it just happens to work out that way. So tell us a little bit about your path to the position that you're in now. What was your degree when you graduated from SDSU, and how did you work your way to the type of work you're doing today?
Yeah. So I have been involved in research, whether it was at a research assistant, entry, doing data collection or data entry, since I was an undergrad, so freshman of undergrad. And so I've been exposed a lot to the research environment. I conducted research and was involved in research throughout my undergrad and really created a love for that. When I was in undergraduate, I didn't really know what I wanted to do. I don't know if anyone actually knows what they want to do when they're getting their undergraduate
Mm-hmm.
degree. But I really fell in love with nutrition and food. I ended up with a biological science degree because that was the degree that I could graduate the quickest with. But I was able to, during my undergraduate, travel and do foreign exchange. I
Oh,
lived in Buenos Aires for a while and was able to travel around there. And I just fell in love with the culture and really the food around the culture and the anthropologic context behind food and celebration, and not just it nurturing you as well. And
right.
then a lot of the research that I was involved in was also around nutrition. And so I just kind of I continued that into my master's degree and got a master's in nutritional science. Um, and really, I worked for the Department of Health for a while, and got exposed to a lot of different areas within the public sector when it comes to public health. And I really wanted to go back and get my PhD. So when I thought about this and was trying to figure out kind of what direction I wanted to go, is I really was focusing on endocrinology and nutrition. And so I decided to go to the University of Colorado in the Colorado School of Public Health and get a PhD in epidemiology, focusing on maternal and child health and life course, with the idea that looking at exposures during pregnancy, like
Mhm.
nutrition or cardiometabolic disease, and the impact that it has on child health later in life. So just kind of bringing that back and food, the food environment, food access, those type of, or that really has always kind of been a passion and centering for me throughout that that journey.
So I like to say I'm a consumer of data. I love using data to tell a story because I think it's so powerful, but I'm not the creator of data. I love learning, but it can just really fill my mind so quickly and I lose track and I go down the wrong direction. And I suppose that's some of the beauty of research too, is those undiscoverables or those new thoughts.
Yep.
Tell us a little bit about Avera Research Institute on a, just broadly, what type of research is done there and how does that get translated into community impact?
Yeah. So Avera Research Institute came to Avera in 2017. And we have really focused, a lot of our research is primarily focused on maternal and child health. And that's really because a lot of the Avera Research faculty that is the main interest
Mm.
of the faculty there. So we have a wide variety of research happening. We have about 35 studies happening at any given time at ARI,
Wow.
and we like to put them in three categories. We have our kind of epidemiological observational studies. So this is and what I think what I'll probably talk about a little bit today is our environmental influences on child health. That's one of our largest observational studies that we have at ARI. And we've done a lot of work and collected a lot of data looking at the food environment and nutrition. And then we have a clinical trial arm. So we do a lot of the clinical trials within the Avera network. And
Mhm.
then we have a service care innovation arm. And so this is where a lot of um, we're working with service lines like the pediatric service line or the OB service line and creating innovative care deliveries and then evaluating those in the community.
That's incredible. I think it's really, again, telling a story with data, but also being able to determine what's a good solution and testing that solution and making sure that there's follow through on that so that it can be shared with a broader group of people as a way to impact long term health,
Yep,
be it through food access or a variety of other things. So
absolutely.
you've done some research on rural hunger.
Yes.
uh, State level research on rural hunger as the food bank in the state isn't incredibly easy for us. Feeding America does an annual Map the Meal Gap, and that looks at the state as a whole and it looks at varying counties. And so we can sort of identify this county is rural or it's in a wide open space. And here's what the food insecurity rate is. But it really comes down to food insecurity is there's a root cause for it. And people who are food insecure can be impacted by one or more of those root causes. And being rural makes that even greater, makes that food access challenge even greater. Have you done some research around that? And if so, what have been your key takeaways?
Yeah. So I think, if we think about root causes of hunger, a lot of times, we think about social determinants of health, right?
Yes.
And social determinants of health are complex. They're interdependent on each other. They make up a variety of factors, and this can be at different levels, right? The individual level, the community level, or even, at a policy level. And so, I want to step back just a second because I
Absolutely.
because I want to make sure that people understand the social determinants of health because I think
Hmm.
so these are determinants that that are could be personal, they could be social, environmental factors. So anything non-medical, right?
So things like a personal could be the type of household you grew up in.
Yep, like household chaos. Let's
That
say.
can influence that. Yep.
Yep. Or
Um,
family
s-
structure.
mhm.
Something
And
like
social could be just the people who you surround yourself with, the influences that you have, right?
yep, yep. So culturally maybe. So like let's say what do when you have birthday parties, what does that look like? Do we have birthday parties? Is it a big kind of family event? Is it a community event? What does that look like? Um, we also, or it's like, what stores or facilities do you have access to?
Yes.
Things
Yes.
like that. So I think, so I think those are really good examples, but I think we also
Yes.
have to think about that they're not, they could be, and even living in rural area, like living in a rural area is a social determinant of health. And social determinants of health aren't inherently bad. So I think that they kind of get a bad rap sometimes because we focus, I think as a society, that's just kind of how we frame things. And but they're not inherently bad. Some of them are
Okay,
good.
so I want to be a guinea pig for a
Yeah.
second.
Yeah.
So I grew up in a fairly large family,
hmm
and my my husband grew up in a smaller family.
Yep.
But when we sit down for a family meal, I'm always done eating first. And he's very laid back and, just kind of casually eating and he'll comment, "You eat so fast." But I grew up in a large family, and if you wanted seconds, you ate fast so that you could get seconds. But I also grew up in a family where you had to finish your food. So whatever you take, you finish.
Clear your
And
plate.
yep, I can still remember probably in about third or fourth grade, sitting at the dining room table in my pajamas in the evening in front of a bowl of cold vegetable soup because I didn't want to eat it. And my dad was like, "This is it. Like, this is okay, then you can go to bed," right? And that would be a social determinant of health, right? So my eating habits today, as far as eating quickly, not allowing the time for my brain to trigger that fullness, which can lead to overeating, is a social determinant of health. Am I on the right track?
I think so.
No.
I mean, I
I'm a
that
bad
would
guinea
be
pig.
that would probably be a factor or a
Okay.
result of a social determinant of health because that I
Okay.
think that is a generational societal thing that has uh, uh, that has impacted the way that we eat, right? Like the
Mm-hmm.
finish your plate
Mm-hmm.
and kind
Yes.
of that is the cultural
Okay.
determinant of health. And then that has then resulted in eating fast. Does that make
Okay.
sense?
Yep.
Yep.
I gotcha. I'm picking up on it. All right. I'm tracking. Okay. This
Yeah.
is why I don't do the
No,
research.
no, this is great. So I think over the last 5, maybe 10 years, healthcare systems and researchers have really realized how important,
Mhm.
and communities have realized how important social determinants of health are, and how they can impact just health and well-being, for that matter. And but I think a lot of the research that happens just in general is happening in large urban cities, right? And this is
Mhm.
natural because that's where the large research institutions sit, right?
Yep.
It's the Columbias, it's Denver with University of Colorado, UCLA, those big large universities in urban areas. And so that really leaves out a group of the population,
Right.
and those that live in rural areas. And so we know that about 20% of Americans live in rural areas. And so we want to, I think, we've talked about ARI and how does that relate to rural health and kind of integrated into care. And I think ARI really, the mission of what we're trying to do is bring research to the prairie and provide
Mhm.
opportunities for individuals to participate and be represented in that research,
Mhm.
because it's the research that then goes to policy and makes
Mhm.
policy changes. So if rural
Yes.
populations aren't included, then we're going to be missed and they're going to be making decisions based on urban areas, right? And so at ARI, we're really trying to get research opportunities out into rural areas so people can participate and be part of that data. So I think,
first of all, I'm floored by 20% of people live rural. That's, I don't know why. I suppose because I'm in a rural state, I thought it would be more. That's incredible. And it really does speak to why there's a lack of information for that subset of people. It's a small group and hard to reach, really. Internet connection in some areas of our state has just become a thing in the last, since COVID. So, it's not as easy as sending an email and said, will you fill this out? So that's, that I think that leans in even more to the importance of the work. And you talked about how that data can influence policy and even as the food bank that serves every county of the state, we want to make sure that the people in those rural communities are getting the access to food that they need. And that might look different than what's happening in Sioux Falls and Rapid City.
And interesting enough that you said that is because we actually just published a paper in the Journal of Rural Health, and it was around obesity. So, but I think the idea of the paper actually was showing the differences, showing that you needed to really look at rurality. So let me back up for a second. So a lot of research, when they look at urban-rural differences, they're just looking at urban and rural. And so when we define rural, we're lumping a lot of different categories because there's actually roughly, let's say, there's a lot of different codes that define rurality or urbanicity, however you want to kind of think of it. And let's in general, it's like 1 to 10, roughly.
Okay.
On if you kind of average all of the codes.
Where are you at on the scale?
Yep. And urban is defined by the first 3 categories, 1, 2, and 3. And then, or maybe 1 and 2. And then rurality makes up the majority of the rest of the codes. But when researchers look at urban rural differences, a lot of times what they do is they group 1 and 2, and then they group 3 to 10 all together into one. And so what this paper, it was led by Dr. McCormack at ARI. What this paper looked at was broke up those groups, those rurality groups, and actually found nuances when looking at the prevalence of obesity across these kind of classifications. Urban rural classifications. And so there are differences even within rural communities. So like when you're talking about, what works maybe in Aberdeen may not work in winter South Dakota. And so we really have to think about what rurality means, right? And thinking about how rurality is defined.
Right, because and maybe this is just part of that categorical numbering, but according to Feeding America, the entire state of South Dakota is rural, right? Like they fit that rural profile. But as somebody who lives in the state, we have quote metro areas, right?
Yep.
But to your point, food access and culture and all of those things in Madison, South Dakota, is different than it is in Lemon, South Dakota.
Mm-hmm.
And so lumping them together kind of, I suppose, averages it out, but it doesn't tell the true story.
Yeah.
So what was like the key takeaway, if I can ask? I mean, people should go read the paper, but spoiler alert, they're not going to probably. But was there a increase in obesity the more rural it was within those categories, or opposite, or neither?
It actually was kind of, I would say, like a wave, right? And so there was this section with it. And actually, if you do find the paper, there's this beautiful graph that we did that
I'm going to go find it. I'm going to go find
beautiful.
it.
But Um, but it was more like a wave. So like the very rural 9 to 10 categories had lower prevalence, but then we had kind of this between, like in the middle, there was an increase, and then kind of this suburban area, like threes and fours, there was an increase as well. So, um, I think the takeaway really is that as researchers, we need to do a better job at classifying urban and rural, or we're going to lose our interpretations and the context and the nuances
Yeah.
that go into that, um, aren't going to be correct necessarily, the interpretations.
So as you look at that takeaway and that curve, do you layer other things on top of that to say, well, that's interesting that this is
Yeah.
happening here where you wouldn't expect it? Does that also mean that there's a high rate of poverty or a high food insecurity rate or a high rate of chronic illness? Do you layer things on top of it to try to get a bigger picture to help
Mhm.
work toward a solution? Or what's the next phase? Or do I just need to go read the report because
No,
that's all in
no.
there?
Yeah, so the next phase, so building off of that research, we are currently right now and we're in kind of finalizing the results. So I'll tell you the preliminary results, draft
Ooh,
results. But
hot off the presses.
so so from that paper, we then now are looking at community level food environment factors and individual sociodemographic factors, and the association that those have on child diet.
Mm-hmm.
And so, and then what we're doing is, okay, we're looking at those associations, but then we're going to we're going to look at them by rurality and urban group.
Mm-hmm.
And so,
Mm-hmm.
uh, um, so we looked at it from urban, small town, suburban, and then rural. And the reason for that, and again, um, and a lot of times the reason why these get grouped into urban versus rural is the sample size, because we don't have a lot of rural
Ah,
participants, right? And so
sure.
to conduct
Sure.
these analyses, you need a certain amount of people in a group
Mm-hmm.
for these analyses to work. And so that's why a lot of times they're having to group categories together. And because of that, that even is more reason to get more rural people involved in research, right? But for this analysis, we looked at how community level food environment factors and individual sociodemographic factors were associated with diet. We had about 13,000 children. So we used the ECHO study. So it's the environmental influences on child outcomes that I mentioned earlier.
Mm-hmm.
This is a national consortium. So there's 69 awards or cohorts across the nation. We are one of them. And we are actually one of the top enrolling sites in ECHO. And so we represent a big portion of the Great Plains and the rural and American Indian populations within the ECHO consortium. And so we used this data on a national level to look at this question. We had about 13,000 children aged 2 to 19. And what we did is we took the USDA Food Environment Index. So if you're familiar with that, and we ran a machine learning analysis. And essentially, what it did is it picked out the top or the most influential factors. So we threw in 26 factors, and we said, okay, tell us which ones influence child diet the most, right?
Mm-hmm.
And we looked in our diet specifically was fruit and vegetable consumption and sugar sweetened beverages.
Yep.
And from that, we found that there were 7 community level factors that were important for fruit and vegetable consumption. And there were 15 community level factors that were important for sugar sweetened beverages. And 6 of
Wow.
those were shared between the two
They
outlets.
overlap.
They overlap.
Huh.
Yep.
So it could go either way.
Yep. Yep. And so it was the ones that were kind of sharing this interest were household food security, SNAP authorized stores. And this will give you an idea of kind of the factors that we were looking at. Farmers markets that accept SNAP,
Hmm.
SNAP benefits per capita, national school lunch program, and full service restaurants. And then
Mm.
we took those 15 factors or uh, 20 some factors. And then we looked at which ones were most associated with fruit, vegetable consumption and sugar sweetened beverages. And we did see a difference based on rurality and urbanicity. And so an interesting point was that most of the individual level factors were not significant in small town and rural. So it
Hmm.
really isn't, this suggests that the community level factors are really driving that relationship between the food environment and the diet in children. Where in the urban models, it's a combination of both individual level factors and community level factors, which I thought was very interesting. I think the biggest takeaway and
That is,
for my
yeah. I mean, that is a huge opportunity to look at. So now what are good solutions around those
Mhm.
things, especially for people like Feeding South Dakota and our community partners that are doing work within both of those types of communities in order to impact not just food access, but the health and nutrition
Mhm.
and, ensure people have the nutrients that they need to be able to thrive because it's not just about getting food to people,
Yep,
it's about getting the right kind of food to people.
absolutely.
So when you talk about solutions though, I mean you're talking about the things that are crossing over and also seeing just some really great differences. But what I'm out of curiosity, what was the number one factor for like the fruit and vegetable consumption?
Yeah. So we found that for fruit and vegetable consumption, that if a community had more full service restaurants, then children were more likely to eat more fruits and vegetables. And so
Okay.
this was true in the overall model when we
Okay.
put everybody together.
Sure.
But when we split it up in by urban, small town, suburban, and rural, into those three groups, we
Mhm.
saw that this was only the case in urban and small town, but not in rural
Not in
communities.
rural.
Yeah,
So what maybe because there aren't a lot of full service restaurants, so it's
that's
not even
yeah,
a factor.
that could be.
What was the top factor for rural?
The top factor, positive factor, was that SNAP benefits. So if the
Mm.
community had more SNAP benefits per capita,
Mhm.
then children were more likely to eat fruit and vegetables or eat consume fruit and vegetables.
Yeah. SNAP can be such a difficult program to talk about. And we won't go too far into it in this conversation, but some people can have a really negative attitude toward people who are utilizing that benefit. But really, as a food bank, we would prefer that more people are accessing that benefit, especially to your point in the rural communities,
Yeah,
because we know it drives revenue for grocers. It helps keep those food access points open in those communities. But it also
absolutely.
gives choice for people at the grocery store instead of like our mobile distribution where it's a pre-packed box. And so I will now add that when it's no longer preliminary and you say I can to the reasons why SNAP is a good program, really
Ab-
for people who qualify for it. Um,
mhm.
and that qualification, we're going to come back to the beginning of the conversation and just note that that qualification, um, yes, it's income based, but that income can be influenced by things that are uncontrollable in rural communities.
Yeah,
Employment availability. Um, do you have the means to travel to the next community that has
yeah,
employment availability? Right. So some of those things you would have to ask people to relocate out of the area they've been in into a different area in order to not to come off of those benefits, and that's not always the
yeah,
solution either. A solution, but not the solution.
absolutely. I think those are really great points and very important points
Hmm.
um, to take into account when you're thinking about that. Absolutely.
So, child hunger is probably one of the most passionate topics that we have people engage with us on, whether it's donors, our community partners, when we're talking with elected officials. I
Mm-hmm.
mean, you can't deny that kids deserve to be fed. But there's a lot of discussion that's been happening around the free meals for all going away, the access to school lunch and breakfast that goes away in the summer,
Yeah.
all of those things. And it does come back to this research that you're doing to say, okay, so Feeding South Dakota, we do the backpack program during the school year, and we partner with schools across the state to do that program. But in the summer, many of those schools are closed, and there's not anybody there to administer a backpack program. And so the amount of backpacks that go out in those months decreases, and it's really only in Sioux Falls and Rapid City because they're running summer school and they have this
Mm-hmm.
place where kids can congregate or come to get that food. But that is just contributing to that problem in those communities. It's not helping that we're not able to do that program in the summer.
Yeah.
But getting there during the summer, having people, those are
Mhm.
all the challenges that come with rural hunger.
Yeah.
So what do you see as the future of that work, that rurality, I mean, we are proud farmers and producers. People desire those wide open spaces. Um, what do you think is the future of that? Are these things going to continue to be an issue as we see communities seem to die instead of thrive?
Yeah. I hope not. I hope
Hmm.
we want to see these communities thrive. And so I think because we are a rural state, I think we have to think of creative solutions.
Yeah.
A lot of the solutions, again, are built for urban areas, and so I think we have to maybe take those ideas, but make them applicable for our rural communities and what those look like. So they're just going to look different. Like resources look different in rural communities compared to urban communities. So I think it's finding solutions that leverage existing infrastructure and resources.
Right.
Um, and I guess thinking from a healthcare perspective, right, being kind of integrated into a rural healthcare system, it's not enough to just refer people when you have food security. We need to be embedding these programs into places where people go, like you're talking
Mhm.
about. So I think are there ways that we can do that? I think we had just started last year. Avera started a Healthy Start program, and I know you guys, Feeding South Dakota, and you, Stacy,
Yeah.
have been deeply involved in that, in
Hmm.
creating a wellness pantry
Yes.
that we or a part of this Healthy Start program
Hmm.
is this pantry where we're screening patients at our OB pediatric and at our Avera Research Institute clinic studies, research studies, or research clinic visits. And if they're positive for food insecurity, we give them that bag. But again, like you said, that's one piece of the puzzle.
Right.
That's
Right.
one piece of the solution. I think
Mhm.
if we're thinking about long term and sustainability, I know SDSU Extension is doing some great
They
things
really are.
on some, community gardens and getting
Mhm.
people back,
Yes.
getting into the
Hmm.
ground and
Yeah.
creating community around food and growing food. I think that's really going to be another great piece if we can continue to build that and build that across South Dakota.
And back to the social determinants of health, even just modeling
Hmm.
the right balance of food on your plate. And it's okay to have something sugary every now and then.
Yep.
And there's challenges, I think, with that too, where some communities don't have a grocery store, but they have a C store, or
Yep.
so that C store might have fruits and vegetables, but they're not the freshest. And when
Hmm.
you're faced with a candy bar or a banana, you know, kids are going to take a candy bar probably. So,
Yep.
having the right foods available at the right time and then modeling. And some of that's education. And I know Extension's doing some really great work with that too. And we hear it with some of the things that go into our boxes that people don't know how to open up a fresh pineapple because they haven't done that before. And
Hmm.
so, um, just being able to include that teaching and why that pineapple is nutritious for you and you should incorporate these types of things into your diet, I think is a really important part of the solution in the work to turn
Yep.
people, toward feeding their bodies with the right foods. And I love how you said, like, going back to that community thing, because progress isn't always growing our metro areas and seeing
Hmm.
our smaller towns shrink. Progress
Yeah.
can be revitalizing those towns,
I think,
and they're
yeah.
different in so many ways.
Yeah. I really think communities are going to be part of the solution.
Yeah,
And I also think that, we have this common notion that what you eat is solely a personal choice, right? And that just isn't true. Yes, ultimately an individual has the choice to
sure.
pick XYZ,
Yep,
right?
yep.
But there's many factors that influence what XYZ
Mm-hmm.
is.
Mm-hmm.
And kind of in research, we call that the food environment,
Yeah.
right? And that's really it's those factors that are the food environment are the factors that are determining what XYZ is. And then it's
Yes.
personal choice.
Yep.
And part of personal choice is, what am I used to? What am I, do I even know how to cook this?
Yep.
Right?
Yep.
Do I know how to store this? Do I even have a refrigerator to store
Mm-hmm.
this in? So I
Mm-hmm.
think there are so many factors that play into choice in the food environment that aren't um, thought about. I think are not that our
Yeah.
initial thought.
And that can be overwhelming. I
Hmm.
mean, I've hosted roundtable discussions in Rapid City with homeless individuals, and because to your point, that's a community within Rapid
Hmm.
City, and
Yep.
so they know what they need and they know what works. And I've not had that experience, and so I don't want to, be part of bringing a solution to them if we haven't gotten their feedback. And that was exactly it. I don't go to your mobile distributions because it's too much food, and I don't have a
Yep.
place. I don't want to carry it around, and I don't have a place to store it, and there's too many perishable or frozen refrigerated items. I need long term. I need the canned food that I can eat next week,
Yep.
or things like that. So
Yep.
that it can be a little overwhelming because we do have to tailor solutions to all of those individual communities.
Yep.
But I'm glad that Avera is doing research that can help us with that, really. And
Hmm.
that's one of the great things, again, about community is that working together, right? We, Feeding South Dakota, can gather the data on who we're serving and where we're seeing increases. And Avera can see doing research on why that could be, while Extension's over here doing research on, how SNAP can be part of the solution. So I think
Yep.
that's a really great thing about the community that we've built around fighting hunger is that it's nobody's holding it close to their chest. We're
Yep.
all working in it together, and that is really an important step.
Yeah. There's too much to do
Hmm.
to hold it to your chest. It's
To
gonna
do it
have to.
alone.
Yep. Absolutely.
Well, before we go, I have one very important question for you, and it really segues well based on our conversation.
Yeah.
If South Dakota were a fruit or a vegetable, what would it be and why?
What would I want it to be, or what do I think South
What
Dakota would be?
what do you think South Dakota would be? And I'm not talking category. I'm like, let's get specific on the type of fruit or vegetable.
Um, I would say it would be a potato.
Okay. That might be the first time that I've gotten that
Yeah,
one.
really?
Expand. Tell me more.
I don't know. I think meat and potatoes. When I think
Yep.
of South Dakota, I think
Mhm.
meat and potatoes.
It's hearty.
Uh, yep. And
Mhm.
so um, that's why I said a potato.
I think it's great. And the first thing that came to my mind is with our 50th anniversary, we've done some digging in the archives.
Yeah.
And one of the photos we found was a potato giveaway in Rapid City back in the day,
Oh,
where there was a truckload of potatoes, and people would line up to get 100 pounds of potatoes put in the trunk of their
wow.
car.
That's
So
yeah.
that's where I went immediately.
Easy to grow, easy to store,
Yeah. Yeah.
fulfilling.
Hmm. They're one of my favorite foods. I love
They're
potatoes.
good.
I
They're
really
good.
do. Well, thank you so much for joining us today. We've really appreciated that conversation. We hope you've learned a lot more about the work that Avera Research Institute is doing and all the factors that go into fighting hunger in the rural areas of South Dakota. If you want to learn more about Avera Research Institute and the work that they're doing, head on over to their website. Join us next week for continued conversation as we dive into rural communities in South Dakota and how we can best serve them and understand the needs to fight hunger. Thanks.